Hi there. I'm going to demonstrate how to inoculate culture plates for the different procedures that we'll be doing for BTT 234 in the bacteriology and microbiology section. The first thing I want to show you is that if you have a liquid sample that you're sampling that you'd like to inoculate onto a plate, then you might need an inoculation loop such as this one. These are found in the upper cabinet. It does need to be sterile before you insert it into your liquid sample. So what you'll do is get the lighter out of the drawer here, and then just heat sterilize this. This lady knows how to turn on a lighter. Until it is red. That flame is real tiny. What's happening? Anyway, you want your little inoculation loop to glow red. That means it's hot enough to be sterile. And then let it cool off. It's aluminum, so it'll cool very quickly. And then you can inoculate your loop with the liquid sample. In order to then later put on your plate. So this is a sheep's blood agar plate that we're going to do for the primary step for bacterial culture. If you have a non-liquid sample, then you might have swabs that are already covered with your bacterial sample. These are sterile swabs in the first place, and I've kept them sterile or clean by putting them back into their sterile packaging during transport so they're not contaminated. My sheep's blood agar, I want to make sure that I label the bottom with the date, my initials, the patient's name, and the sample type. Open up your plate, and then if you have a liquid, then use your inoculation loop. And remember, this is your quadrant pattern. So we're going to start very lightly streaking so that you barely see the little line. I don't know if it's visible or not on screen, probably not. Not too much pressure because you don't want to be damaging that agar. And then a quarter turn and zigzag across, quarter turn, and one final quarter turn.
Move your hand back to where you had it for a second. Yeah. I was trying to see it at an angle to see the streaks. Yeah, there you go.
Good. See it?
Yeah.
Okay, great.
Needed the light to reflect.
We're going to cover that. We're going to be incubating this upside down so that condensation doesn't drop onto our sample and contaminate it. Incubate upside down for at least 24 hours. Then on the following day, you will tease off your isolated bacterial colony that you want to identify. You will streak that onto a microscope slide. You'll gram stain it and evaluate it under the microscope. Then you'll take your Mueller-Hinton agar in order to set up an antibiotic sensitivity test. So one more time, you will tease off whichever colony is of particular interest, and that's the one colony then that you will streak onto your Mueller-Hinton plate for sensitivity. So I'll just demonstrate teasing off, so just very slightly pick up which colony that you'd like to inoculate with the sterile swab. Get your Mueller-Hinton plate, and this is where you're going to do the full coverage technique. So very lightly streak all the way across, 1/4 turn, zigzag lightly all the way across, 1/4 turn, all the way across, 1/4 turn, and then the final act here is to do a circle all the way around the outer edge. Remember that you might be dealing with biohazard material. Keep that in mind when you're disposing of your items. We're going to put the cover on, label it, and now we're going to apply our sensitivity discs to our inoculated plate. So you will want to ensure that you have 5 different antibiotic impregnated discs. They are labeled, and each individual disc does have a code on it that identifies it for what it is. Most of these come in a dispensing system. Sometimes these malfunction, so you'll also want to ensure that you have a sterile hemostat available to help you pull the disc out of the dispensing system if it doesn't pop out on its own, and to gently tamp it down onto your plate. So when this functions properly, it should look like this, that you just gently pop out, making sure you don't contaminate your plate. Each disc, and then switch to the next antibiotic disc. Oops, got static there. And if they don't come out easily, then they are malfunctioning. So taking your sterile hemostat and pulling them out is acceptable, and then setting them down. They should be evenly spaced around about 1/3 of the diameter of the plate. Gently tamp that down. It's not functioning properly. Skip that one. And on this particular one, which is amoxicillin clavulanic acid, there's actually not a dispensing system. They don't make that same system anymore for the dispensers that we have, so we'll just pull the disc out of the end, or push it in this case with the hemostat. Push it forward. Not that one, because that one's contaminated, it just fell on the floor. There you go. All right. So unlike this demonstration plate, you should have 5 fairly evenly spaced antibiotic sensitivity discs. You will note on your skill log which ones you've applied. Cover this, turn it upside down, incubate for 24 hours. When we return in 24 hours, what we should see are zones of inhibition around the antibiotic discs to which the bacteria is sensitive, meaning that the bacteria will not have colonized around that disc, or the disc is actually killing or inhibiting the growth of that bacteria around that area. You'll take a metric ruler and measure the diameter of that inhibition zone around each disc and note the distance. And that will help determine how susceptible your bacteria is to the antibiotics that you apply to them, which will give the doctor input into which antibiotic therapy is appropriate for this patient's infection.